Well, agriculture is known as one of the most dangerous industries, and in an effort to help protect producers, AgriSafe is highlighting National Farm Safety and Health Week, which has been celebrated each September since 1944. Well, Total Farmer Health Director Tara Haskins joins us now with the latest insight. Tara, thanks for chatting with us. Now, I understand that there's an upcoming panel on mental health innovations in agriculture communities. Tell us a little bit more about that event and what it'll focus on.
Oh, yes, and thank you for having me this morning. We're really excited about this webinar. Innovations are not created in a vacuum, and the best innovation comes when you work interdisciplinary. So this webinar is going to bring a panel of speakers from diverse backgrounds and perspectives. AgriSafe belongs to the Southern Farm and Ranch Stress Assistance Network in the Southern region, and we have 25 amazing partners covering 13 states and territories, and the speakers are coming from that network. Dr. Joan Mazur from the Southeast Center for Ag, Health, and Injury Prevention is going to explore with our webinar audience the development of the farmer-specific hotline in her state of Kentucky. And Dr. Bronaugh, for the Commissioner of Virginia Department of Ag and Consumer Services, is going to share the initiatives that her team is building to address mental health in ag. And I'm going to be one of the speakers as well, and I'm going to bring a registered nurse's perspective of the understanding and impact that culture brings to mental health initiatives, because this year's theme is Every Farmer Counts. So we thought this was a great way to sort of highlight that theme.
Is there a different focus for agriculture communities when it does come to mental health, distress, or illnesses?
Well, I think the short answer is yes, and particularly when you're talking about cross-cultural, the diverse ag producers that we have, and we have a very diverse population in ag producers with regards to race and culture, because there are a lot of things that can drive someone's response to mental illness, their individual health beliefs, symptoms, the way they respond to stress, even the interpretation of words that we use when we talk about mental health issues with these distinct cultural groups. So access to mental health care is already challenging in rural America. So by being sensitive about the cultural issues that drive those barriers is one of those steps to improve access to care.
Of course, what is the goal of National Farm Safety and Health Week, and why, of course, is it so important that we also bring mental health or mental illness and wellness into the conversation?
Oh, I'm so glad you asked that. So the overall goal is to improve the well-being of agricultural producers, families, and communities. And honestly, you can't have the conversation of safety and health without the discussion of mental health. And at AgriSafe, we are seeing a significant rise in the registrations for our webinars with a mental health focus. And for a healthcare provider, that tells me a couple of things. There's an increased need for mental health programming in ag populations, and the communities and organizations in those areas recognize the importance and want to be part of the solution. So for someone that's been a nurse for over 30 years, that shift in the community perspective of mental health is very encouraging and hopeful.
Well, of course, you can go online to agrisafe.org for additional information and some of the webinar information. AgriSafe Total Farmer Health Director Tara Haskins joining us on the phone. We appreciate her time today from Fort Worth, Texas.